Your live microphone.
Good afternoon, members of the press. Good afternoon, Barbados. Since we last spoke to you in relation to the development of COVID here in Barbados, the Ministry of Health and Wellness would have continued with its enhanced posture at ports of entry, as well as the continuation of our aggressive contact tracing initiative. And it is through this initiative that we have been able to identify a number of persons who would have been into direct contact with some of the confirmed cases that we have identified a few days ago. As a result of that, the Public Health Laboratory was able to conduct about 20 tests, of which 8 tests returned as positive. So there are now 8 new cases in Barbados as a result of the testing that has been conducted. Of these 8 cases, 7 are directly related to 2 of the previously confirmed cases, and 1, the other test result is for a visitor who tested positive. So to repeat that, there are 8 new cases, 7 as a result of the aggressive contact tracing initiative which we've implemented, and the other case is the case of a visitor who tested positive. So that brings the tally to 14 confirmed cases here in Barbados. Let me stress that at this stage, there is no community developments in terms of cases in Barbados, and we are managing this process, and we expected and anticipated that there would have been an increase in the numbers because that is a result of contact tracing. And it is very important for the ministry and its officials to be able to identify, locate, and treat to all contacts so that we could contain the spread of this virus in this country. Those are the developments in terms of what we've been doing at the testing level in the country. And I'll now hand you over to the Chief Medical Officer who will provide some additional details.
Thank you very much, Minister. Good evening, members of the press and fellow Barbadians. So as you would have just heard, the Minister would have explained that we now have 14 cases of COVID-19 in Barbados. We have a total of 9 women and 5 men who are positive for COVID-19 in Barbados. One key point that I would like to stress on is that the majority of the cases that were recently diagnosed yesterday, 7 out of 8 were diagnosed out of contact tracing efforts. And contact tracing is one of the cardinal things that we do in public health in order to contain the spread of contagion such as the coronavirus that causes COVID-19. So the other thing that I would ask you, members of the press and members of the public, is to please bear with us when we are vague on certain details because we simply do not want to breach patient confidentiality and we don't want to provide information that could possibly impair the contact tracing efforts that we are doing within the Ministry of Health. But suffice to say that we have many different public health teams based at the polyclinics throughout the island who are engaged in contact tracing. So you take your index case and you find out all of the persons that one person came into contact with. If a person is symptomatic who came into contact with a known COVID case, then we do a swab. For those persons who are not symptomatic, we place those persons in quarantine. Quarantine is absolutely essential to contain the spread of COVID-19 in Barbados. So with that, I open the floor for questions.
Good evening. Can you tell us through the contact tracing where some of these people would have been? If these people would have been in hotels, airports, church, I don't know, where would they have gone?
So all I can say at this point is that 7 of the persons who were diagnosed yesterday out of contact tracing, all persons in Barbados, would have been to many, many different places. And we are working very aggressively to go to every single person and go to every single place that they themselves would have come into contact with. So it's a variety of places.
You all are not going to make an appeal for people who might have been in contact with these same people to possibly come in to get
So
tested?
the only way I could do that is if I breach patient confidentiality and give the names, which is an absolute no-no. I can't do that.
What can you say about the health condition of these 14 cases?
So what I can say is that all persons will be in isolation. So we have 6 persons who were previously diagnosed in isolation, and they're all doing well. And these persons are in the process of going into isolation. This is a process that would have started this morning and should be completed by tomorrow. No one is gravely ill. So they're all mildly ill at this particular point. But it's important to also appreciate that they can deteriorate at any time. And that's why it's important for them to be in medical facilities where we can monitor them and continue isolation.
How many people are we able to accommodate at the quarantine facilities at this point, and when will they be available to the process?
Sorry, when they're available?
The quarantine centers.
So the quarantine facility currently has a capacity of 60 beds. But I think you're also asking about the isolation facility, correct?
Yeah.
So currently, right now, as it stands today, even without the Harrison's Point facility being completed, we can accommodate 46 persons in isolation.
We've been hearing that at the QEH hospital, the asthma bay has been affected because of the process. It involves vapors. Is that so? And how will you all treat asthma patients from now on?
Right. So what we are recommending to persons is to call ahead. Please do not go to your healthcare facilities. Please do not go to the accident emergency department. If you have a respiratory problem, you have to call ahead. When you call ahead, you will be directed as to where to go. Currently, all polyclinics, all 9 polyclinics can manage and see respiratory cases, and so can the hospital. But that part about triaging, you have to call ahead first so we can know how we can manage you.
So the asthmatics can still go to the asthma
You have
bay?
to call ahead, because if you are an asthmatic and you're a suspected case of COVID-19, there's a different spin. You're going to have to be managed very differently. However, if you're an asthmatic and you have absolutely no symptoms and signs in keeping with COVID-19, so your asthma attack is not associated with a fever, for instance, or not associated with a sore throat, we recommend that you can still go to accident emergency, but that has to be a decision between the healthcare providers and the patient. Don't just turn up, don't make any assumptions. You have to call ahead. You can always call the hotline of the Ministry of Health to get guidance where that is concerned, or you can call your healthcare provider directly.
Okay, with all the information that you just gave out, we are still at stage 1.
So thank you for asking that. We are actually now at stage 2 with human-to-human transmission as evidenced by the contact tracing that we did. And if I may, at this point, I'm going to ask Mr. Richard Carter to explain a little bit about stage 2, what that entails, and what are the recommendations from the government of Barbados.
Thank you, CMO. Good evening, members of the press. Good evening, Barbados. I want to address the issue of stage 2 because we've been speaking about this from the very beginning as a series of stages, each one having its attendant recommendations in relation to how we seek to contain and deal with the threat of COVID-19. First of all, as the CMO would have just indicated, we have moved to stage 2, which is a stage characterized by in-country transmission. So a number of the cases that have tested positive have no travel history and are associated with cases that have been imported. Stage 2 means that we now move beyond the simple guidance that we have issued in relation to gathering, and the recommendation now coming from the government of Barbados and from the public health officials is that we limit the gathering of persons to no more than 25 persons. This is recreational gatherings and gatherings in relation to non-essential services. The expectation of the government of Barbados, obviously, is that there are essential services that will still need to continue People will still need to go to work. People will still need to conduct the businesses that are related to delivering essential services to the people of Barbados. I also want to take this opportunity to speak to the challenge of the hotline. We have been getting feedback about persons calling the hotline and having difficulty in getting through because of the large number or the large volume of calls that have been coming to that hotline. And the government of Barbados is now moving to beef up the hotline provision in terms of the capacity, increase the number of persons who will be available to respond because of the anticipated and already noticed increase in the numbers of persons calling the hotline. Furthermore, there are a number of things that are going on behind the scenes, and I would also like to reflect those because although we have now moved to stage 2, our planning has always been at least one stage ahead. Earlier today, we would have visited the Harrison Point facility and to get an appreciation and understanding of the level of preparation for that facility, which will provide us with additional capacity for both isolation as well as quarantine. So that is one of the things that is going on behind the scenes. The Prime Minister would have announced, I believe last night, that there are a number of steps that are being put in place in relation to a $20 million household survival program. We are already moving to put into action the measures that have been outlined in relation to that program. Corporate Barbados and the wider Barbadian public and Friends of Barbados are invited to come forward and support the adoption of our Families program, which is one of the components that has been identified by the Prime Minister. There is a dedicated WhatsApp number, 255-1000, 255-1000, where members of the corporate community, members of the wider Barbadian public, Friends of Barbados who are resident here can WhatsApp their intent or their willingness to support vulnerable families. We have already identified and we have already received a number of offers of support, both of materials as well as cash, to support the response or elements of the response. I would also like to take this opportunity to acknowledge the enormous sacrifice, commitment, and determination of Barbadians from several walks of life in mounting the response. I spoke about the efforts at Harrison's Point, which are ongoing, but the tremendous dedication of the staff of the Ministry of Health, particularly our public health officials, because even though people will naturally be concerned about the number of cases that we have seen, the fact is that this is due to the aggressiveness of the public health officials in contact tracing. And we should see the fact that we've been able to identify cases as, in some respects, a victory, because it allows us both to identify, to isolate, and hopefully to contain further spread. Countries that are not testing have no way of knowing, or are not aggressively contact tracing, have no way of knowing the numbers of cases that are circulating in country. Not only the work at Harrison's Point, but there is tremendous work also ongoing by the media, and we want to acknowledge and thank the media for their huge support in communicating to Barbadians and attempting to provide Barbadians with the factual information that will allow them to take reasonable action in response to the challenge that we are all facing. Finally, I would also like to acknowledge the maturity of the Barbadian democracy, which has been expressed in public expressions of confidence in the constructive criticism that has been given of the national response. We are of course comforted by the level of acknowledgement of confidence in the approach that has been mounted by the government, but we are also welcoming the constructive criticism because it allows us to examine what we are doing in the light of those comments that are presented to us. And we welcome constructive criticism because at the end of the day, we are only going to succeed in this if we have everyone on board, everyone committed, everyone taking reasoned and reasonable action as guided by the public health officials.
I don't know who's to answer. But in And how will public gatherings be policed to ensure that people comply?
So this is where we are appealing to the very last thing I said, reasoned and reasonable responses by the citizens of Barbados. And we have come to this point in our history through the level of dedication and commitment that Barbadians have given to following public order. We have always been an ordered country, an ordered and disciplined country. And in fact, we attract criticism from elsewhere because of the public discipline that we have exhibited in the conduct of our affairs. We are facing a public health emergency, not of our making, not of anybody's making as such, but we are facing a public health emergency. We are facing a global pandemic. If the instruction is given, if the advice is given that one of the measures to protect ourselves and to respond to that lies in avoiding mass gatherings of 25 persons, and that is the advice that is given, then we expect people to self-police. In other words, to adhere to the guidance that has been given. There are, and we hope that it does not come to this, but there are legislative or statutory provisions where people disobey the instruction of public health authorities, that those legislative provisions can be invoked. We have the security of this country to take into consideration and the health and well-being of the entire country. And if it becomes necessary, then those additional powers will be invoked in order to ensure compliance.
Okay, what does that mean for church tomorrow and supermarkets, etc.?
Now, a number of churches have already announced the steps that they're taking in terms of restriction of their membership. We have not come to these recommendations lightly because we recognize that in times of crisis, in times of stress, in times of personal concern, that the church is one of the places that people naturally turn to. And we want to encourage the churches to be part of the national response and part of the outreach as far as possible. There are churches in Barbados that could accommodate 50 people comfortably with the level of social distancing that we are proposing. But if we have given an instruction or a recommendation of 25, we expect that people will adhere to this. A number of churches have indicated that they are prepared to be streaming their services. We are also working with the media to support live broadcasts so people can join the services virtually through their televisions. In respect of supermarkets, a couple of supermarkets have already started the process of responding to the restrictions by offering separate opening hours for the particularly vulnerable among us. And a couple of supermarkets have also moved to the stage of, and other business places, of restricting the entry into the to the compound to a prescribed number of persons. And we would recommend that those supermarkets and other businesses take these particular steps in terms of mounting their response or complying with the recommendations that we have put forward, limit the number of persons coming into the establishment, and basically limit those numbers in accordance with the guidance that is being provided.
We are now at stage 2. Several people are on the breadline right now. A number of people are being sent home from hotels and other establishments for reasons we know why. How soon will people be able to access the household fund?
So the Prime Minister announced yesterday the establishment of the Household Survival Program, made up of a number of components. And those components are obviously widely available to the media, and we would urge, obviously, that the media uses the resources at their disposal to ensure that the Barbadian public is aware of those provisions. In terms of how soon, we have already begun the process of identification of the most vulnerable families in Barbados. In fact, a lot of that work preceded COVID-19, and a lot of that work has been ongoing through the Poverty Alleviation Program, through the Ministry of People Empowerment and Elder Affairs. And over the course of the next week, we will be moving to actuate or to actually deliver and operationalize the delivery of the services to these vulnerable populations, as well as ensure that the proposals that are contained in the recommendations delivered by the Prime Minister are actually delivered.
Okay, I just want to go back a little bit with the mass gatherings. Are you all going to provide a list where you say to people, these are some of the areas you really should not go into? For example, I use church, but there are restaurants, there are a whole set of things. Are you all going to provide a list to guide people?
So if, well, I can take advice from the Chief Medical Officer, but if the recommendation is that we restrict mass gatherings at this point where we are to 25 persons, we expect that this recommendation will be taken by all establishments in Barbados, except for those essential services. And yes, it would make sense for us to identify, for the avoidance of doubt, the core essential services. Obviously, public services have to continue to be delivered in the country because these are essential services that will keep the country going. There would be little point, for example, in us stopping the government from functioning because the government needs to function in order to deliver the very things that the government has been created for. Did you want to say anything additional?
Stage 2, what does this mean for the Queen Elizabeth Hospital as it relates to the level of preparedness at our critical healthcare institution?
This is clearly for the Chief Medical Officer.
What I would say to you is that through the Government Information Service, and PSAs have been completed over the last 24 hours, and those will be released in very soon.
There was a complaint from the nurses' quarters, I don't know if it reached you all, about the protection equipment. Do we have enough for the nurses, one, and do we have enough nurses to contend with what is happening now? Because we were supposed to bring in nurses, they're not here.
Yeah.
How much pressure is that going to place on our healthcare system now?
So with regards to PPE, and then I'll hand over to Minister Bostic, we have sufficient supplies of personal protection equipment, protective equipment, and we've ordered more, which will be in shortly. But as it stands right now, current stock levels are adequate for PPE. Minister, regarding nurses.
We said from the beginning that we have a dual responsibility. First of all, to maintain the regular and high-quality healthcare service that we've been delivering to Barbadians within the healthcare sector. And now we have also COVID to deal with. We have resources, and the additional resources that you spoke to just now in relation to nurses, and I believe you're speaking to the nurses coming from Ghana, that is still on the cards, and we are making provisions for those nurses to arrive in Barbados. But I can say to you that given the nature of the COVID-19 virus and the level of spread, and to some extent the degree of uncertainty, we are not taking any chances. And as a result of that, we are going to be calling on all Barbadians who can play a part in this in terms of assisting us with the continuation of healthcare services in this country, like retired nurses and doctors, private sector nurses and doctors, people who might have done nursing assistant courses and so on. There's a role for everyone in this process. Even retired policemen, for example, to assist us with the contact tracing. We are utilizing and calling on all Barbadians who are willing to volunteer their services to us, because we do not know exactly how far this will go, and we intend to be able to cover all eventualities. So this is the approach that the Ministry of Health and Wellness is taking.
My final question for the Minister is, while we were at stage 0, you can say Barbadians were in panic mode. We are now at stage 2. What words would you like to share with the people of this nation at this point?
I would share the words that Barbadians should continue to to have the confidence in the public health officials in this country. I've only been minister for 2 years, but I can say to you that I myself have great confidence in the capacity and the ability of the persons who we have in the public health care sector. The sector is strong, it is good. We have people who can get the job done. I will say to Barbadians that naturally the numbers will continue to rise. But that is primarily because of the work that has to be done and that is being done by public health officials to ensure that we get all of those persons who might have had direct contact with confirmed cases, persons who might have been exposed, so that we can manage the situation. And once we are able to do that, the escalation, yes, will continue for a bit, but the time will come where we will be able to contain this situation, and that is the level that we are at now, containment. I can say to Barbadians to remain calm, follow the instructions of public health officials and the PSAs, that the public service announcements by the ministry, by the government information service and other reputable organizations, and to join us in this effort by doing exactly what we ask you to do. Play your part with all of the sanitary things that we've said to you, the social distancing, and also if you see people who require your assistance in terms of getting them to do the right thing, we are counting on you. This is an all-Barbados effort, an all-Barbados approach. And once we continue to operate in that way, we are going to overcome this. There's no challenge that as a country with the collective wisdom of Barbadians that we cannot overcome together. And we are not doing it alone. We have the support of regional and international health organizations, and they can say to you that we can do this together.
I just want, there are 14 cases in Barbados. What about the ones that were tested on the cruise ship? There's a number for those confirmed cases?
There are four confirmed cases on the cruise ships. Well, we'll be back again to give you further updates, and we hope that you will continue to keep Barbadians sensitized as to exactly what we're doing. So thank you very much. We're testing every day because as we follow the leads in terms of contact tracing, then we are doing testing. And so this is a daily occurrence. So we'll be able to report, and we promise that we will report to you whenever we have any additional cases or information, and we'll continue to do so. Thank you very much.